Assalamu alaikum friends, welcome to my channel MBBS and BDS lectures. Today our topic is related to general surgery post-operative care. Before going to explanation, if you want to watch the same lecture in Urdu Hindi, I already upload the same lecture in Urdu Hindi on my YouTube channel. Go and watch this video. But if you want to watch in English language, then this video is for you. Now today topic post-operative care objective. There are in today topic we will study three major heading. Number one, definition of post-operative care. Number two, objectives of post-operative care. Number three, phases of post-operative care. First we start from definition of post-operative care. What is post-operative care? A care patient receive after surgery is called post-operative care. It often includes pain and wound management. The definition of post-operative care is a care patient receive after surgery is called post-operative care. It often includes pain and wound management. Number two, objectives. There are four objectives of post-operative care. Number one, assessment of patient after surgery. Mean after surgery, assessment of condition of patient. Number two, provide pain relief after surgery. After surgery, provide pain relief to patient is the second objective of post-operative care. Number three, provide prophylactic for early complication. For early complication of surgery, provide prophylactic treatment is the third objective of post-operative care. Number four, maintain proper record of patient. Maintenance of proper record of patient like history, examination, pulse, BP. This record maintenance is the fourth objective of post-operative care. Now come to the phases of post-operative care. There are three phases of post-operative care. Number one, immediate phase or care at OT mean operation theatre. Number two, care in the ward. When from OT patient shift to the ward, then the second phase is care in the ward. The third phase is care after hospital discharge. Mean when patient discharged from hospital and reach to the home, then this third phase is the care after hospital discharge. Now, first is immediate phase or care at operation theatre include A, B, C, FCS. We remember by mnemonics A, B, C, F, S, C. First A. A mean airway. At operation theatre in immediate phase, we should place a patient on artificial airway till that time when patient normal its own airway become normal. Number two, breathing. We should keep patient on artificial airway for breathing till the time when patient natural airway become normal. Number three, C mean circulation. Circulation mean pulse BP monitor 4 times per hour. Mean in circulation we check the pulse of patient and we should monitor BP of patient 4 times per hour. Mean quarter per hour, 4 times per hour. Now FF mean fluid balance. We should we should provide blood product or crystalloids to patient in order to maintain its fluid balance. C mean core temperature. Core temperature mean when we do surgery of patient After surgery, the BP of patient become low. The BP of patient become down, and at that time we should transfer the patient to warm room. Core temperature means shift to warm room, means shift patient to warm room, because already the patient temperature become low. S mean special factor. Special factor mean we should repeatedly monitor some factor, like if a patient have a cardiac disease, or patient of cardiac disease, or do surgery of heart, we should repeatedly monitor the ECG of patient. If a patient is suffer from diabetes, we should repeatedly monitor the blood glucose of that patient. Special factor mean repeated monitoring of certain special factor like ECG, blood glucose. This is the immediate phase or care at operation theatre, which include airway, breathing, circulation, fluid balance, core temperature and special factor. And remember by mnemonics A, B, C, F, S, C. Now come to the second phase of postoperative care, care in the ward. When patient shift from OT to the ward, then the second phase of postoperative care is start. Care in the ward include 6 factors. Number 1, skin care of pressure areas. When patient lie on bed, we should change the position of patient on bed, because when patient lying on same side, it create the pressure areas which is painful for patient. Now we should repeatedly change the position of patient on bed in order to care of skin care of pressure areas. Number 2, in ward we provide pain management to the patient. Number 3, fluid balance maintain 70 kg 2.5 liter fluid. Number 3 is fluid balance maintain. We should maintain the fluid balance of patient. If a patient weight is 70 kg, we should provide 2.5 liter of fluid per day to the 70 kg patient. Number 4 is blood transfusion. If patient require blood transfusion, we should do blood transfusion to the patient in the ward. Number 5 is nutrition. We should provide nutrition to the patient in the ward in order to heal the surgical site. Nutrition is necessary for healing of the wound, for healing of the surgical site. Number 6, surgical drain. We should provide surgical drain in the ward. Surgical drain are 3 types. Number 1 is NG tube drain. Number 2, chest tube drain. Number 3, drain at operative site. First is NG tube drain, means nasogastric tube drain. This drain is necessary for nutrition of patient and also to remove the fluid from stomach. Number 2, chest tube drain. By chest tube drain, we remove the blood and air from the chest of the patient in the condition of hemothorax and pneumothorax. The third is drain at operative site. Drain at operative site remove blood fluid which accumulated the operative site. By drain we remove this fluid at operative site. This 6th factor come in the care in the ward, like skin care of pressure areas. Number 2, pain management. Number 3, fluid balance maintenance. Number 4, blood transfusion. Number 5, nutrition. And number 6, surgical drain. Now come to the last phase of postoperative care, care after hospital discharge. When we discharge the patient from hospital, we provide care after hospital discharge, which include 3. Number 1, avoid physical activity. We should tell to the patient they should avoid the physical activity for certain time. Like in orthopedic, when a patient hand is broken, we tell to the patient avoid the physical activity from 3 to 4 months. Like in, and also we provide number 2 physiotherapy. We tell some exercise to the patient like finger movement for normal, to maintain the normal function of finger and hand. A broken hand, we prescribe the physiotherapy to the patient. Number 3, tell about wound infection which occur at first week of surgery. In first week of surgery, mostly the wound infection occur, and we should tell already to the patient if they have wound infection, if they develop wound infection, they should go to the other doctor or should come to our hospital for cleaning of the wound infection site. This is the 3 phases of postoperative care. Number 1, immediate phase or care at operation theatre. Number 2, care in the ward. Number 3, care after hospital discharge. Now today our topic is complete. We study postoperative care definition, objectives, phases of postoperative care. Now today our topic is complete. If you like my video, press the like button and share these videos with your friends. If you're new to my channel, subscribe my channel by pressing the red subscribe button and also press the bell icon to open the notification in order to you receive my each new video notification. For watching my videos, I am very thankful to you. Thank you very much.